Hi, everybody. This is Alheli Keener. Thank you so much for joining us today. We're going to go ahead and get started since we only have 60 minutes. We have some wonderful speakers for you today. Mansell Nelson, Michael King, and Josie Kemkoff from ITEP. We also have Audrey Johnson, manager of our Quality Assurance Group, who will be joining us to answer questions about quality assurance plans or QAPPs. We only have an hour with you today, so we're going to ask that we hold questions until the end of the presentations, but please go ahead and type them into the chat box as they come up. Again, did I introduce myself? This is Alheli Keener. I'm the Indoor Environments and Asthma Coordinator for US EPA Region 9, and I'm going to talk to you a little bit about indoor air quality, developing indoor air quality programs, and the GAP guidance. Okay. So let's talk about indoor air quality. The importance of indoor air quality, it's become very clear to us. As for many months now, we've been spending a lot of time indoors, probably cleaning and disinfecting a little bit more than usual because of COVID-19. And then came fire season, forcing many of those that were lucky enough not to have to evacuate to close our doors and remain indoors. So outdoor air combined with consumer products and chemicals and perfumes and hair products and things that we use indoors make up the air that we breathe indoors. It's estimated that people spend approximately 90% of their time indoors, and that indoor air can be 2 to 5 times more contaminated and sometimes up to 100 times more contaminated than outdoor air. The quality of our indoor air affects us all, but especially our most vulnerable. So the elderly, people with health conditions like asthma and heart and lung disease, and especially children because they're still growing and their organs are still developing. Indoor air pollution can have immediate effects on your health, like trigger your asthma or irritate your eyes and throat, or cause you to feel tired, but indoor air can also have long-term effects like cause respiratory disease, heart disease, and even cancer. It's more important to recognize that indoor air quality affects your health, even if symptoms are not immediately noticeable. So indoor air is not a regulatory program that has clear standards to follow. So sharing information with the community you serve on what they can do to improve their indoor air is extremely important. It's the key. We're hoping that you'll consider adding indoor air activities to future GAP work plans because it's a direct way to protect human health. It's something that's real to people. It can have an immediate impact, and personally, I believe that it's also very rewarding work. It allows you to build relationships with your community and help them in a way that is very important to them. So I'm going to breeze through some of these examples of things to work on. There's many more possibilities. Okay, so asthma is a huge issue in Native American communities, affecting 12% of people living in tribal communities, which is almost double the current national average of 7.7%. 10.2% of Native children are affected by asthma compared to 7.5% of children in the US. You can do indoor air work focused on doing outreach and education on asthma triggers, for example. This is just as important for those that don't have asthma because it improves indoor air quality. Promoting the concept of healthy homes is another possibility. This slide shows the 8 principles of a healthy home. Education and outreach about wood burning stoves is another possibility. A lot of people use and depend on them. There's resources available to assist with stove replacements, and this reduces smoke indoors and outdoors. Integrated pest management is another possibility, doing outreach and education to help your community understand what to do before they reach for chemicals and pesticides. And green cleaning is another possibility, which focuses on eliminating the use of harmful chemicals indoors. Okay, so let's review GAP eligibility. We're going to spend a little bit more time on this. So I'm going to review what it says in the guidance and then a few of the specific capacity indicators that you can cite in your work plan. So the GAP guidance under program priorities says that resources should support developing and maintaining core environmental program capacities. Education and outreach is one of these core capacities. It also says that GAP resources can support doing a baseline needs assessment, which can help you determine what to focus on. I'll talk a little bit more about this at the end. So again, education and communication is a GAP program priority. Okay, so the first capacity indicator that I wanted to touch on is in the guidebook, Capacity B, you can develop a general environmental education component that focuses on a variety of education outreach topics. So this could cover ambient and indoor air, solid waste, recycling, or illegal dumping. But your outreach and education component needs to set up a system to notify the public of important events, publicize activities like your Earth Day events, for example. It includes engaging the community so that they can tell you about their environmental or public health concerns. And it should also set up ways for you as the Tribal Environmental Protection Program or agency to set up ways to communicate information with them and on issues that are important to the tribe. My slides are advancing automatically and it's throwing me off. Sorry, guys. Okay, so this capacity indicator, indicator C, is focused on building tribal ambient and indoor air quality program capacities. I highlighted here some examples of program capacities that are eligible under this indicator, and I'll just mention a few. Doing an indoor air quality assessment and report. You can establish a radon program that includes outreach and education. You can prepare recommendations on how to improve indoor air quality, establish a program to do indoor air quality outreach, education, and training for tribal government officials and also for community members. Okay, and then the last indicator I wanted to point out to you is indicator G, which focuses on chemical safety and pollution prevention. This one is focused touches on asbestos, lead, pesticides, and other toxics. So again, doing a lot of the similar activities like assessments, establishing community outreach and education programs, establishing public participation and community involvement programs, and other important work that will improve indoor air quality and environmental health. So here's some ideas on how to get started. This first one is actually not an idea, this one is a requirement. The first step is to make sure that environmental health, education, outreach appear in your EPA tribal environmental plan. So definitely make sure that that's in there. Second step would be to reach out to us for resources and technical assistance. And the suggestion we touched upon was doing an indoor air baseline needs assessment to help you organize your thoughts and plan. And here from the GAP Guidebook, Appendix 2 is a diagram for doing a baseline needs assessment. It just illustrates the steps that you can take to identify and prioritize. And of course, you can use this or you're welcome to develop your own approach. Okay, I think the most important thing to remember is that the focus of the GAP program is for you to build capacity, you and your environmental program staff. The air capacity indicator says that the first stage is to develop the necessary expertise and skills, assign staff, acquire training, compile relevant data, and engage the community, and of course, collect and analyze data so that you can further develop a program. Okay, so just a few more thoughts on how to begin building capacity. Expanding your knowledge base is number one, learning the issues so that you can identify them as you plan your program. Identify needed skills that you want to acquire to help you do a better job. Reach out to tribal council members and other representatives. You always learn from speaking to others and learning about their needs and priorities. And reach out to tribes doing similar work. If you don't know of who they are, you can always reach out to me or your project officer and we can point you to some folks to talk to. Again, call us at EPA if you need more and technical assistance. You can also reach out to ITEP for training and technical assistance. And the National Tribal Air Association has an indoor air and wood smoke work group that would really benefit from your participation. NAPEC, the Native American Environmental Protection Coalition, is a consortium of tribes, and they also have training every year and ask for input on the types of training that tribes need. Collaborate and coordinate with others working in your community. So local health centers, the Indian Health Service, HUD, Head Start, senior centers, after school youth programs. Always great to coordinate with folks. Also identify what tools you need to do your work. For example, you might need a webinar platform if you're going to be reaching out to large groups of people right now in the age of COVID, for example. Oops, okay. And you might actually need actual tools like a carbon dioxide meter or a moisture meter. And I think Mansel's going to talk about that in his presentation in a second. Okay, so wanted to share this great example from Region 10. This is a sample template and it's just the first page, but there's a link here at the bottom for you to see the whole thing. There's other templates in there as well on different topics. But this shows you sample activities that you can do. The only caveat here is to remember not to copy and paste directly from this your work plan. I know that Region 9 looks out for that, and a lot of these here are very specific to Region 10, so they'll definitely know if you're copying and pasting. And here's my contact information. Sorry I'm talking so fast, we only have 10 minutes, but thank you so much everybody, and I'll be here to answer questions at the end. And I'm gonna stop sharing my screen now.
Mansell, if you're speaking, you are on mute and we can't hear you.
There we go. Is that better? All right, thanks. Yeah, so as I was saying, my name's Mansell and I'm on the ITEP staff and I'm project director for the Indoor Air Quality and Tribal Communities program. And this is going to be the highlights of my presentation. There'll be some overlaps with the previous presentation, but I'll be getting into some additional detail in some areas. And as Ali mentioned, we're very concerned about health impacts from indoor air quality. A couple that I would like to highlight is particularly protecting our young children. These are my grandchildren, and I'm very concerned for their health and their susceptibility because problems with air quality and impacts of air pollution can affect a child for a lifetime. It's also noteworthy that air quality impacts can affect the brain. There's been strong connections between air pollution and cognitive decline, including Alzheimer's disease. So definitely want you to be aware that there are issues there. Ali mentioned needs assessment, and so the GAP Guidebook will give you some guidelines for that. But I wanted to mention that there's two broad categories that I'd recommend you work in. One is more of the technical side. These are talking to experts and the health clinic and others about what are some major influences on your community. And then of course you also want to hear from the community themselves what their concerns are. And as you move forward, you're going to want to address both. You're going to want to address concerns from the community, but you're also going to want to make sure that you're addressing those technical issues that have been identified by experts. This is just a quick chart to demonstrate some thinking that you might put into priorities. You're not going to have time to do everything. So you're going to have to identify some areas that you might want to work in, and you might want to think about impacts, about interest from your community. You definitely want to work on things that will catch their attention and then lead them to other issues that they should be thinking about. When you're looking at your needs, I'd recommend looking at first source control in our indoor environments. That means eliminating things that are causing problems. And then of course, ventilation and air cleaning are important components of conducting an indoor quality program. Ali mentioned some of the training resources. These links will be available to you because you can download this. I understand you can download these from the conference website now. So EPA has lots of training resources that I encourage you to look at. ITEP, we also have a variety of training resources. During COVID, we've had to make some adjustments, but I've conducted a full training. In fact, we have some folks here that participated in that. We're doing webinars, and I'm always available for technical assistance. So, and then I do listserv where I share information. In fact, like this morning, there was an update on COVID and impacts to indoor quality, and I shared that via one of our listservs. So if you're interested in that kind of information, encourage you to join, and that would be the ITEP newsletters link. Of course, HUD has a lot of information in their Healthy Homes program, and there is the National Center for Healthy Housing. I've attended some of their trainings, and if they're having one in your area, that might be another avenue for helping you get prepared to work on your indoor quality program. This is what you'll see if you go to the ITEP website. Right now with COVID, a lot of our courses are online. So I encourage you to check out the website and find out trainings that are available. As you consider education for yourself and for your community, there's lots of resources. I pointed you to the ITEP or to the EPA website, but these are some of the resources that you might want to be identifying to help you with your education efforts in your communities. Some of these might be resources that you would distribute to them. One of my favorite ways to conduct education is introducing people to tools that they can use in their own homes to improve the health of their home. So there's the concept called the Air Matters Kit. It was developed by Tribal Healthy Homes Network, but I've adopted it, and I encourage all tribes to adopt something similar, and you could modify this kit to the needs of your community. But I like using it in an educational role, so I give them a relative humidity meter, and I teach them how to use that meter to help avoid mold and to make a healthier home. I give them some microfiber cloths to help them with cleaning their home. So a very action-oriented approach to teaching people, and that's why I like this Air Matters Kit. This is a publication that was recently updated by HUD. I was involved in its development. The National Tribal Air Association was involved, and they got a lot of input from a lot of communities, and I highly commend these materials for you to use in your outreach efforts to reach to your communities. I want to highlight one thing that I've seen successful indoor quality programs adopt, and that is partnerships. So today we're talking probably predominantly to environmental staff. You want to develop partnerships, housing staff. So they have responsibility for a lot of the homes that are that your tribal members are living in. And sometimes building different homes to begin with can be helpful. Sometimes homes need repairs. So they should be a partner. And a lot of people report to me that developing these partnerships are challenging, but once they're developed, they can lead to greater success. And of course, you also want to partner with the healthcare staff. Ali mentioned asthma. So you want to talk to your clinic about, well, what kind of asthma rates are you seeing, and what kind of events are occurring that might contribute to that. And are the health staff even talking to people about their environment and what's happening in their home? So those kind of partnerships can help you with greater success in developing your indoor air quality program. Ali mentioned instruments, and these are some basic instruments to consider. But notice at the bottom of the slide, I say the most important tools are your senses, making observations and thinking. One of the things that none of these instruments do is think for you. And I often have people that think, well, I can get one instrument, I can put it in the middle of the room, and it's gonna tell me everything I need to know. And even though we're improving in artificial intelligence and sensors, that instrument doesn't exist yet. So you really got to be thinking and observing. And even if you are using instruments, observations can help you determine what kind of measurements you might want to consider. And that can lead to more questions and more observations. So I'm very careful to tell people, if you're thinking about developing an indoor quality program, it's not the first thing you do. You don't just go out and buy a bunch of instruments, but they can be a great supplement to your overall program. We've created a folder for you with a lot of resources to help you as you get into your program. So again, you'll be able to download this slide and get this link. I'm putting resources in there, and I can put in more that will help you with implementing your program. And I'm gonna wrap up with a brief discussion on COVID issues related to indoor quality, and then turn it over to Mike King. We know there's a connection between poor air quality and COVID. In fact, they've seen increased death resulting from the COVID disease connected to air quality issues. So it's really important that we take steps to improve our air quality during this COVID pandemic. And of course, it's also important to reduce our risk by taking a variety of different actions. And so I'm hoping that you're hearing about all these, but if you're not, then reach out to us and we can connect you to recordings of webinars and things, get you involved in the discussions to help you with managing COVID issues in your community. In fact, one of those is this one. You can email me, or you can click on this link. It's the NTA website. We just recently did a webinar on COVID. So there's my contact information, and I'm going to switch the slides over to Mike and mute myself. And thank you. Look forward to hearing from some of you.
Thank you,
Mike,
Matt.
Yeah, I was just going to say, make sure you unmute yourself, Mike.
Thank you, Mansell. Again, my name is Michael King. I'm currently the Technology Specialist 3 with the Tribal Air Monitoring Support Center. The TAM Center is a cooperative agreement with US EPA to provide technical support to tribes throughout Indian country. Prior to working with the TAM Center, I was a Senior Environmental Specialist with the NAVAJO Nation EPA Air Quality Control Program. In this presentation, I just want to provide an overview of the implementation of a tribal indoor air program that was an ongoing with the NAVAJO Nation EPA. All right, next slide. So NAVAJO EPA Air Quality Control Program, it's funded through a 105 Clean Air grant. They do a lot of ambient air monitoring. They look at open burning of household waste, so they implemented an open burning regulations, and also just recently included an indoor air quality component to that 105 grant program. Also, the air quality control programs consist of an operating permits program where the tribe oversees, so far, I believe, 13 Title V sources. And the whole purpose of the program, again, is to protect human health, residents of the NAVAJO Nation and tribal members, as well as the environment, and then be able to oversee and permit these major sources of emissions. Okay, next slide. So indoor air quality became a concern a while back. There was a study done by the United States Geological Survey in 2010, identifying wood coal stoves as a source of impacts to indoor air quality. Here's just a couple graphs showing to the top left is 24-hour averages of PM 2.5 concentrations within homes on the Navajo Nation. And the red dotted line you can see there is the NAC standard, which is set at 35 micrograms per cubic meter. So in a lot of these tribal homes, they were seen 2 times, even 3 times exceedances of that standard. And again, that standard's a health-based standard to protect human health. To your right of that chart, you'll see these little red arrows. These little red arrows are indicating when those concentrations were increasing. Through this study, they were able to identify that those instances were coincidentally occurring with when residents or occupants within the homes were stoking their stoves or adding wood or coal to their stoves. The chart below, it just shows a number of hospital admissions at the Northern Navajo Medical Center, which is located in Shiprock, New Mexico, in the Four Corners region. As you can see, as the winter months come around and people start burning more often, you can see the increases in the hospital admissions for respiratory ailments. Okay, next slide. So again, just addressing the IEQ issue on Navajo Nation, an indoor air quality component was added to the Cleaner Act 105 grant work plan. It began simply with just developing outreach material. This is just material targeting ways to properly burn the right fuels within your stove, maintaining your stove, and just basic outreach. Also, part of the indoor air quality component included indoor air quality measurements. We were able to develop a quality assurance project plan to support the IEQ work. In addition, there was also other entities, universities that became involved in conducting research on Navajo Nation to look at residential wood smoke and impacts of wood coal smoke to human health and tribal members. Lastly, there was a mitigation project, wood coal stove changeout project that was implemented due to a Cleaner Act violation at a local power plant, Four Corners Power Plant, here located in the Four Corners region. And I'll talk a little about that later on. Okay, next slide. So again, these are some outreach material we developed. A lot of it was public service announcements, poster board kind of set up information about best burning practices, tips for cleaner stoves and healthier homes. This included just basic utilization of smoke detectors, proper ventilation, again, burning the right fuels, and also maintenance and repairing and upkeep of your wood stoves. Okay, next slide. So we also utilized NAU ITEP intern and also an intern funded through the NAVAJO EPA program to provide support and development of wood and coal stove intervention videos. These are just short 5-minute videos. A lot of them were based, a lot of them were done in the Navajo or Diné language and with English subtitles. Okay, next slide. Again, indoor air quality assessments were conducted. This is just some indoor air quality monitors that were obtained through collaboration with the University of Tulsa as part of an indoor air quality home to school asthma study, as well as through the Tribal Monitoring Support Center. Okay, next slide. Again, through the supplemental environmental project through the Four Corners Power Plant Cleaner Act violation, there was $4.7 million provided to replace older wood and coal stoves with cleaner burning heating appliances and to weatherize homes of the Navajo Nation. There's 750 stoves to be changed out over a 5-year period. I'll talk a little bit about some of that work here in the next slides. Next slide, please. So again, the settlement agreement was in 2015. There was work done with several stove manufacturers on identifying a dual fuel stove that could burn wood and coal and meet EPA certification. So as of right now, there's been a stove that has been identified, the NAVAJO hybrid stove, and it's been the stove that's been used as part of that CHANGEOUT project, and it's ongoing. Should come to completion in 2022. Again, with approximately 600 to 700 homes identified and stoves changed out. Okay, next slide. This is again a picture of the NAVAJO hybrid stove. Next slide.
Michael, I just want to give you a 3-minute warning.
Okay, all right, thank you. So again, this is the NAVAJO hybrid wood coal stove. It was EPA certified back in 2017. Okay, next slide. And just the insulation. Next slide. Next slide. Additional installation information. Also, again, there's additional studies that were done in collaboration with different universities. One was with CU Boulder and Diné College to look at the impacts of heating stove replacement on indoor and outdoor air pollution in Shiprock, New Mexico. Next slide. This is just some of the work that was being done during as part of that preliminary study. Next slide, please. And this is just to look at a typical stove that you would find inside a tribal home here in Shiprock, New Mexico area. You could see that stove has been replaced with the NAVAJO hybrid stove. Next slide, please. So again, there's part of that wood stove changeout project. There's 7 communities that have been identified. These are communities that have been impacted by the Four Corners power plant emissions. And again, the research study will document and quantify any improvements in indoor air quality and health outcomes resulting from the stove changeout. Okay, next slide. So lessons learned from implementing the indoor air quality project is you don't have a lot of money to carry out a project. Of course, there was supplemental environmental project funds for the wood stove changeout, but as far as doing the initial indoor air quality work through the 105 grant, we did reach out to several universities to collaborate on different research components or aspects of looking at wood coal smoke intervention, and also utilizing Tribal Air Monitoring Support Center to through their equipment loan program to use indoor air quality meters to understand particulate pollution in the indoor environment. Okay, next slide. So these are, again, the programs that offer assistance to improve IAQ. This was kind of touched on before in the previous slides. Next slide. And that's the contact information for NAVAJO EPA Air Quality Control Program. If there's any additional questions, I'll be around to answer those questions on behalf of the program. Thank you.
All right, good afternoon, everybody, and thank you, Ali, Mansell, and Mike for your presentations. I think my presentation makes everybody else look really interesting. My name is Josephine Kamkoff. I work for ITEP. I teach quality assurance project planning online, and I also do some work for Mansell in the environmental education outreach program. And we're going to talk about your quality assurance project plans and how you're going to put your project together for your indoor air quality monitoring program. And I'd like to begin with a brief explanation of a quality assurance project plan. And now I'm going to say QAPP because that's a mouthful to say that over and over. So I've struggled between, do I call it a QAPP or a QAPP? But if I say QAPP, I can think of a duck, so let's just how I somehow memorized it. So all a QAPP is it's a document that describes your plan for collecting and using environmental information and data. And really what that is that you just figure out everything that you're going to do and how you're going to do it and when you're going to do it and who's going to do it, and from beginning to end. So there's a way, and it's just really methodically planning out how you're going to measure indoor air quality, what you're going to measure, and what you're going to do with the information, how you're going to just make decisions with it. And so the first thing is to decide if you need a QAPP. And so I really want to emphasize it to make sure to contact the EPA Region 9 Quality Assurance Unit before you begin. Really, especially if this is a new project, if it's an ongoing project, you might have a pre-existing QAPP that you just need to edit. And if you're new to environmental project planning, you should just learn about QAPPs, because they're going to come up with every single project that you work on that's EPA funded. And by law, any EPA funded monitoring project must have an EPA approved QAPP before it can begin collecting samples. And samples include physical samples, and it also includes measurements. And in the case of this indoor air quality, would also include things like simple things like your temperature and the humidity levels. And the purpose of that requirement is to ensure that the data collected by monitoring projects are of known and suitable quality and quantity. So, like, you could use the cheapest, most available measuring equipment you could find, but it might not be very accurate. It might not be accurate enough. And another thing that you really don't want to do is you don't want to go out and buy the best, most accurate equipment that there is, because you want the best program ever, and then find out that your measurements are way too accurate and you just wasted a bunch of money. So that's also really important. Next slide, please. So for an indoor air quality program for educational outreach, we have 6 elements that are required. Now, an element is a section of a QAPP, and like a category 1 QAPP has 24 required elements. And this is for educational outreach, it doesn't have such rigid requirements, but you do need to make sure you do some things. And the first thing that you need is a title and approval sheet, and that is just something that has who, like the EPA, it's EPA approved QAPP, and that's it. I'm not going to explain that much more. The name of your program, the name of your tribe, and all that stuff. The second thing that you're going to need is a project description and a task description, and this has quite a bit more information in it. You want to include, there's a number of things that you'll want to include, and I didn't type them all out because it would be a lot of reading, but that includes the monitoring objectives, the work required to collect the document and report, the work required to collect, document, and report the data, your regulatory standards, the duration of your project, milestones and timelines, what kind of activities you'll be doing when you're assessing the indoor air quality, anything that you're going to send to a lab, any kind of scheduling, and who's responsible for completing what tasks. And then also you'll want to make sure that you list out any kind of documents that you're going to want to produce or that are required to be present when you're taking measurements or collecting measurements. And the next thing that you're going to want to have data quality objectives and criteria. And this is just really pretty dry to go over, but it's really, really important that you follow a 7-step process. And I don't have time to go over that right now, but you also need to include the intended use of the data, and you have to make sure that the types of data are clearly listed. You'll want to make sure that you have some kind of an error limit so that you know when you're really getting your measurements off, or if they're just completely outside the range, your equipment might be broken or something. And then you'll also want to have some measurement quality objectives, and those have to be appropriate, adequate, and acceptable. And what that means is that there's a way to say that, you know, the objective of this measurement is to make sure that the seals and the wood stoves are not emitting so much ash and smoke into the house that you know, people are getting severely ill, or there's other things that go along with that, but that's kind of the gist of it. And you're going to want some data quality objectives and data quality indicators, just to make sure that the equipment isn't broken. You want to make sure that it's representative of what you're measuring. Like if you're going from house to house, you're going to have to go from house to house. But for schools with the same HVAC system, you might be able to pick a school or pick 2 schools and count those as the same, as a representative of all of the schools in the region. You're going to want to make sure that there are limits established, and that what kind of statistics you're reporting is decided before you even begin collecting data. That's really important, I think. Because if you've already collected the data and you decide on the statistics, or you decide on your reporting methods, you might find that you have taken it in wrong intervals, or the wrong level of accuracy. And next, you're going to want to do your network description or your sample process design. In here, you have to describe your rationale for your network design, your network objectives, sampling locations. You have to identify every single pollutant that you will be monitoring or measuring. You're going to want some schedules and some frequencies for everything that you're measuring, and you want those all listed out separately. You're going to want to list what kind of site it is, whether it's a house or a school or tribal building. And you even might want to include if it's a tribal home or a privately owned home owned by a tribal member or a non-tribal member. You're going to want to include some criteria for evaluating potential sites. So, like, are you not going to measure people who are not tribal members? Are they excluded from your program? And you want to decide in advance what factors influence your site selection. So you'll just have to sit down and figure out who you can help. And I think that's very, very important. Next, you'll have to do some analytical methods. So you're going to have to write up some SOPs for every single parameter that you're measuring: the temperature, humidity, dew point on the windows, all of that stuff, mold. And then identify laboratories. I think maybe if you're going to do that, if you're going to, send some mold samples to a lab, which might be unlikely, but you never know. And decide on the sample media, what kind of containers you'll use, how you're going to preserve it, how long it can be preserved, and stuff like that. But hopefully you won't require many analytical methods, because you're just going around trying to see if people's houses are healthy. You will need some preparation of quality control samples. So that would be another thing that would really involve mostly mold. And QC checks on your analytical equipment if that's needed, but that's unlikely with this kind of program. Next, you're going to want some quality control requirements. You'll want the rationale for the design and the calibration scale. So this sounds like really terrifying and kind of intimidating, but if you're doing indoor air quality in homes, it's really not that bad. You're just really going to want to, like, if you're going to measure radon, you don't measure radon in the attic. You measure radon in the basement, because that's where it's coming in. And so if you want like the average temperature of the main living area, then you want to measure it more in the room, then you don't want to put it like your thermometer next to the window or something like that. And then so then there's also different scales of measurements that you're going to take, like if you're measuring PM 2.5 or PM 10, and why you've decided on those different particulate matter sizes. Whether, you know, if you're going to, you have equipment that needs to be calibrated, what is your acceptance criteria for that? Like, when are you going to say, no, this data is no good? How often are you going to do that? You'll have to decide on that. You'll have to decide how.
Sorry, I just want to give you a 3-minute warning. Thank you.
Oh, all right, thank you. You'll have to decide on how often you're going to do quality control checks on your equipment. And it's really important to make sure that you have your concentrations and ranges pre-decided. So before you do your QC checks, you will already know, like, you know, if these measurements are, let's say, if it says the house is 120 degrees, we're going to reject that. So it's not really this really super intimidating thing. It's pretty important. So that would be your quality control acceptance criteria. Another thing that's really important would be examples of invalid quality control checks. So this would be something where you have compelling evidence. It's not like a solid for sure thing, but you do have to have some kind of compelling evidence that this data is incorrect. Like, let's say if you have a relative humidity meter in the house and somebody put a bookshelf in front of it, you know, it's hanging on the wall and somebody put a bookshelf in front of it, and before the relative humidity was like around 35% because it's been a little bit dry or it's cold outside and the heater's on, and then all of a sudden the measurements are going down to 8 or 9%. If that happened when the bookshelf was put right in front of there, then that is compelling evidence that that data is invalid. So it's really not, you know, it's not as crazy as it sounds. Another thing that's really important is your quality control samples collected. And so you're going to want to make sure that, again, I think this would mostly be mold, is that you're not risking any kind of contamination. Also, some things you're going to want to collect some co-located data. This would be especially important with radon, where you would have 2 different monitors in the basement, and you would check the difference between those measurements to make sure that the equipment that you're using is accurate. You really want to have some procedures to follow if your QC checks exceed your acceptance criteria. So if your measurements are too high all the time, then you're going to be able to go back and recalibrate your instruments or figure out what's going on and correct the mistakes that have been made. Another thing that's a really, really important part of this is documentation and reporting requirements, the types of QC checks and calibrations performed on the equipment. And you also want to know if your samples, if your data measurements fail to meet the specifications, when are you going to invalidate that data and retake the measurements? Like, say, for instance, if your radon measurements were 2 picocuries, and then all of a sudden they went up to like 10, then what are you going to do about it? Are you going to say that those 10s are invalid, or are you going to say that those 10s are real and then begin a remediation plan? Yeah. And the next slide, please. I've got some contacts for you here, and that would be Mansell, Michael, myself, Ali, and Audrey Johnson also, who might be your first contact. but we're available to answer questions about your home assessment quality assurance project plan. And I hope that I didn't make it too intimidating or give you too much information. It's an awful lot to pack into 10 minutes. And it's not as bad as it sounds to write up a QAPP for indoor air quality. Audrey's available for all of your questions and about any of the topics that we've discussed.
Thank you. And we haven't received any questions in the chat box yet. So I don't know if we want to open up the questions, let people unmute to ask any of their questions on indoor air quality.
Julianne, this is Audrey. I just wanted to say to everybody that's participating in the group, you know, feel free. I think Josie did an excellent job of kind of describing, you know, the elements of a QAPP. But I do want to encourage anybody who is interested in, you know, taking on a project or gets grant funds for indoor air quality work to reach out to me. Do not hesitate. My staff is there to provide you support and help you out in determining what the appropriate QA documentation is for your particular project. And so we are here to help you. So keep my contact info handy.
While we're waiting to see if there's any questions, this is Mansell again. I just want to, similar to what Audrey just said, encourage you to reach out with your questions and discussions on what you might want to do. You're not going to be able to accomplish everything for indoor quality because lack of resources and time. So you're going to have to establish some priorities, and we'd be happy to work with you on discussing what would be the priorities for your community and your situation, because every community is going to be a little bit different as to your needs, as well as your typical climates and building structures, etc. So each program is going to be unique, and we're happy to work with you each to work on that. And I do see one question accurately saying that there's no standards for indoor quality, and that's not absolutely true. There are some guidelines. For example, there's a guideline for an action level of 4 picocuries per liter of radon. So there are things like that. But as far as when you say, does ITEP EPA have any recommendations? And the answer is yes. You're going to want to develop those uniquely for your community. There's not overarching rules or guidelines. But for example, you want your home to be mold-free. So there are things you can do to ensure that, monitoring relative humidity, etc. So I would recommend you take some of our trainings and figure out what is appropriate, because this is not a regulatory program. We're not trying to do enforcement. We're trying to do the practical things that would make a home healthy, a school healthy, a tribal building healthy. So one of the things that I talked about briefly, for example, was COVID. You want a well-ventilated building to reduce your risk from exposure to COVID. So there are guidelines on what defines a well-ventilated building, but these are not regulatory. So there'd be what we'd call guidance or suggestions. So hopefully that at least gives a starting point for that answer.
One thing that you can consider is that you could, in your QAPP, pick your project and task descriptions and decide on everything that you're going to measure, and from that information set your data quality objectives and criteria, and make that your standard for your program.
We did have one more question come in the chat box. Do we anticipate that there will be special attention to indoor air concerns with the pandemic and the safety regarding air circulation and HVAC units?
This is Mansell, and there should be. Again, it's not regulatory. There's not going to be anyone to say you have to do this or that. But in fact, CDC recently released additional guidelines acknowledging that there are aerosols that can go beyond the 6-foot parameter, which means that ventilation is even more important, particularly ventilation with outside air. So yes, that's definitely something you want to work on. I worked with the National Tribal Air Association to do a series of webinars, and those recordings are available. These are presentations from experts that are working on answering that exact question. And so I'd recommend that you view those webinars, and then if you have more specific questions, I know I would be happy to talk to you and work with you on that issue.
Okay, we only have 2 minutes left. Is there one last question? Does anyone have burning question? If not, we can, I put the link to the presentations in the chat box, so you can download the PowerPoint and definitely reach out to the speakers. Thanks, everyone. Vanessa, is there another session today, or is this the last one of the day?
This is the last one. We have the afternoon lobby, which is for like if anyone had any troubles today or needs any help preparing for tomorrow. So that's open to anyone who needs it. But other than that, if there's no more questions for this session, I'm going to go ahead and end the meeting. So thank you, everyone. Thank you to our presenters. I hope everyone has a great day.
Thank you, everyone. This is Alheli. Rest of your day.